The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. We are going to start in a couple minutes. Just waiting for a few more people to roll through. Thanks. Good morning, everyone. Thank you so much for joining me this very snowy Tuesday morning for this month's advocacy webinar. Hopefully, the snow isn't too bad where you are in the state. You can go about your day. So, today we have a few things to discuss. Not much. So, today's webinar will be a bit short. So first thing I want to mention, today's webinar is the last webinar that's going to happen on GoToWebinar. Starting next month, we are actually switching to Zoom. Um, Prevention Action Alliance has switched to Zoom for all of our other meetings and webinars, and this is really the last one that still needs to be brought over to Zoom. So let's give a quick round of applause for GoToWebinar for all the webinars that service has provided us over the last couple of years. But we are going to Zoom, and I just put a little screenshot for how registration is going to look. I feel like we all know how Zoom functions now because I feel like all of our meetings are on Zoom nowadays. So I am actually going to put the link for our next webinar, or the registration link for our next webinar, into the chat, so that if you all want to take time to register for that now, you can. We will be sending out the registration link via our weekly legislative update as normal. That's not going to change, but just want to throw that in the chat for you all, just in case you want to take some time to register this morning as I go through some things. Okay, now that that is out of the way, uh, next point of conversation uh, about the General Assembly. Because we have new leadership, you have President Huffman in the Senate. This is his first term as Senate President, and Speaker Cupp, who took over for Householder and was officially appointed as Speaker this General Assembly. They have the opportunity to restructure how the General Assembly functions every 2 years. And one of those opportunities is the creation or elimination of committees. So there are a couple new committees that have been created this General Assembly that we have not seen, at least I have not seen since my time working here, or during my time working here, and my previous time working as an aide in the Senate. Uh, Not all of the committees apply to us and apply to the work that we do. However, there are two in particular, both of them in the House, that I want to highlight. The first one that was created that I really want to highlight is the Behavioral Health and Recovery Supports Committee. Now, this committee, again, brand new, is chaired by Representative Carruthers. So if you or anyone you know in your area or bordering areas have Representative Carruthers as their representative and their constituent of that office, that is probably a good relationship uh, to build. Since this committee, we're envisioning that this committee is going to take the majority, if not all, of our behavioral health prevention related issues and bills. And I can drop a link in the chat again. Um, and this link will take you to the House committee page for that committee so that you can see everyone that's on there. So give me 1 second. Okay, that should be in the chat for you all. So again, it's chaired by Representative Carruthers, and I'll move this so you all can see it. Okay, so it's chaired by Representative Carruthers. Vice chair is Rep. Pavliga, and then Representative Boyd is the ranking member. So these are all the individuals on that committee. Let me know if you have any questions about that. The second committee that I really want to highlight is the Families, Aging, and Human Services Committee. Now, I'm not quite sure how many prevention-related issues this committee is going to have, but I've been surprised in the past. I know last General Assembly we spent a lot of time in Senate Agriculture and House Agriculture for a few bills. So you never know where bills are going to end up. It really just depends on how uh, leadership wants to, move forward with them. But I think this is also another committee that would be worth paying attention to, chaired by Representative Manchester, vice chaired by Representative Catrona, and then Representative Liston, who is a physician, is the ranking member on that committee. So again, if you go to this committee page, and I will also drop this committee page in the chat as well, and you recognize any of these members as members that represent your part of the state or your district, again, I highly, highly, highly recommend that you reach out to their office, try to facilitate or build that relationship. Um, we do have Advocacy Week coming up on March 1st. Registration for that has already closed. Um, Now, if you still want to participate, even though registration has closed, just let me know. I'm scheduling appointments starting this week. So really after this week, I'm not going to be able to add anyone to that list. Um, but if you, for some reason, missed the deadline or didn't see the notices, you can send me a quick email at jpdorval@preventionactionalliance.org, and we can kind of figure it out to see if you need to register yourself or if you can hop on or join one of the already registered teams if there are registered teams from your part of the state. So yeah, take a look at these committee members if you have not done so already. Some of them are freshman legislators, and with every new General Assembly, with every new member, it's a new opportunity to explain what prevention is and its importance in the state. So I highly recommend you all do that if you have the time. So really the last thing I want to discuss, and again, I mentioned that this is going to be a really short webinar because there isn't much happening, is the biennial budget. So ahead of schedule last week, Governor DeWine released his budget proposal. And the budget proposal is really a compilation of all of the agency proposals, along with some high-level initiatives that he wants to tackle, over the next 2 fiscal years. So in that proposal, and I will, again, another link, put a link to the Blue Book, which is the Department of Budget and Management summary of the governor's budget proposal into the chat so that you guys can look at it. It's a bit complicated. It's a very long document, but it is a summary document. Over the next couple of months, I will be doing a deeper dive. As of right now, what we're waiting for is we're waiting for the General Assembly to release the actual bill, right? This is all high-level explanations and summaries and dollar amounts, but the General Assembly language is the actual uh, is the actual bill document itself is what we're waiting for from the General Assembly, and that will tell us, if there are restrictions, recommendations, any caveats that exist with the language. And obviously, the General Assembly is its own body, so it'll throw things in that aren't in this budget. That's kind of where we are right now, but we're kind of in a holding pattern. So there isn't much to discuss, and everyone's kind of in you know budget mode right now. So that's where we are. But in the governor's proposed budget and in the proposed budget of the department, both Department of Mental Health and Addiction Services, and I believe Health and Human Services as well, there are no behavioral health cuts. Or cuts related to behavioral health, which is great. I know early in the summer we were advocating for flat funding, because of the pandemic, because of the forecasted decrease in tax revenue. We wanted to make sure that no behavioral health cuts resulted from that. And based on this initial look at the proposed budget, looks like we succeeded in that. There will be an influx in federal funds, and not all those funds are released. So it'll be interesting to see how those federal funds come into play and where the General Assembly chooses to utilize those extra funds. Um, and in addition to that, the student wellness and success dollars are back. I know a couple folks, didn't necessarily have an issue, but did have questions about the implementation. I believe the Department of Education released a report on how those dollars were utilized. I still have yet to look at that, but we will have a conversation about that in a couple minutes. Um, so next step, tomorrow, a lot of the agency department heads are going to be testifying on their proposed budgets, in-house finance. And just as a refresher, the budget always originates in the House. So the House will get a crack at it first. They'll have hearings. First, they're going to have the directors of the agencies provide hearings, which is going to be tomorrow. So Director McLeod from Health and Human Services and Director Chris from Ohio Moss will give testimony on agency proposals, in-house finance. And then after that, they will break up into subcommittees, and each subcommittee is going to tackle a portion of the bill. So you'll have subcommittee on Health and Human Services and things of that nature, which is where we're going to be. So yeah, so that's kind of a very high level view of the budget, where we are right now in the process. What I do want to ask you all on this webinar is, as we analyze the budget language once that comes out of the General Assembly, what would you like us to keep an eye out for? Last budget, I know a lot of folks, had asks regarding student wellness and success dollars and the reporting mechanism for that. That is one thing that we're going to take a very close look at this General Assembly to make sure they expanded those dollars, and I believe they added prevention as one of the uses, and I believe the department is requiring that schools partner with behavioral health organizations. It's no longer a if or may. They have to in order to use these dollars, if I'm not mistaken. But again, once the language comes out, we'll get more details on that. But what would you like us to keep an eye out for? So I am going to just pause there and allow any questions to come through. I really want this to be more of a discussion. If you want to speak, feel free to raise your hand using the raise hand function, and I can try unmuting you. And we can have a conversation about that. So Nonia, I see. Okay, yes. Can you hear me?
Yep, there we go.
There we go.
So I guess two things that I'm always kind of looking for when I'm, attending these webinars is those funding opportunities that are going to kind of, sift down to the local level. And I noticed you
Right.
put the student wellness and success dollars.
Right.
That's really good to kind of keep track of and know when it's coming. And so that's one thing. The other thing I think that we talk about having this opportunity, but I very rarely know where to interject it at.
Mm-hmm.
I would love to be sharing our data more than we are. And I don't know, I hate to just like kind of randomly be sending data to representatives and senators. And I just wonder sometimes if there's, you might recognize a good spot to kind of send that stuff, because obviously I'm not tracking things like you are. So those
Right.
are the two things that came into mind.
Right. No, that makes a lot of sense. So, when it comes to the student wellness and success, when that language comes out and I really see, if there are any new reporting mechanisms and things of that nature and timelines, I'll let you all know. When it comes to the sharing of data, are you talking about local data from your part of the state or state data as a whole?
Local data.
Local data. Okay, so again, shameless plug. Advocacy Week is a great time to do that. It's
Right.
a
Oh,
great, right,
absolutely.
right,
We always do then, for
right,
sure, for
right.
sure.
But I see what you're saying, and you want to make sure that the data is being read and is actually being considered. So I would say if you have not done so already for your coalition, send an introductory letter to your representative and senator, just outlining who you are and what you do in their part of the state or in their district. And then you can have some data attached to that. Because I will say, now that we're in budget season, and especially with Director Chris giving testimony on these proposals tomorrow, I've heard from folks in the House at least that people are starting to talk about prevention. Um, so everyone should I mean, people are going to be more attentive to data and, info from their part of the state now that we're in budget season, than other times of the year. So actually in a we're in a perfect time to share that information. So if you want to wait until Advocacy Week to make that initial introduction, that's fine. If you want to send an email out to, say, hey, we're a coalition that's, in your district, we do X, Y, and Z for your constituents. We're going to, we're participating in Prevention Action Alliance at Advocacy Week, or, after, the first week of March, we would love to have a follow-up meeting with you. That's completely fine. And if you ever have an issue connecting with the offices, you send emails, and you don't hear anything back, let me know. Because I have ways to get their attention. I can ask around and say, okay, well, is this aid, in and out or whatever. So just let me know. But hopefully that answers your question. But yeah, yeah.
Yeah, that's helpful. Like I said, it's just hard to know. Like, you hate to send it and it gets lost because it's not the right time and they don't really know, what this could be, helpful for. And
Right.
yeah, no, I appreciate the input. Thank you.
No problem. Thank you. Thank you. Yeah, that and again for everyone, I love that question. Just to reiterate, now is really the best time. I actually received a request. I'm blanking on the representative's name, but it was from an office. PAA sent an introductory letter a couple weeks ago, and they actually asked us for behavioral health data statewide. Um, they were very vague, and I don't think they really understood what they were asking for. But it just shows you that the gears are turning, and now that we're in budget season, um, now is actually the best time to share that information on what's working in your state and all of the great accomplishments you and your coalition have done and the great results that you've had. Okay, so any other questions about the budget, things that you would like us to keep an eye out for? Obviously, the funding that hits locally is important. Anything else? Okay, so it doesn't look like we have any other questions. But what I will say before we move to conclude today is the legislature, the Legislative Services Commission, they do an analysis or forecast how much revenue they foresee coming into the state um, during the next 2 fiscal years. And this time around, their forecast is actually, I think, about 800 million more dollars than what the Wine administration's or the governor's budget office forecasted. So I would also like us to keep that in mind as well. In addition to the federal funds that are going to roll through, um, this $800 million difference, which they'll probably just meet in the middle and look at it as $400 million difference, that's also another opportunity for increased funding. So again, we'll see. All the legislators, they kind of have their pet projects. They're going to throw some, random things in the bill like they always do, but that's one thing that we want to note. And I did see one question come through, so give me 1 second. Yes, phenomenal question, Lois. So Lois asked, does Prevention Action Alliance have any concerns about the legislation aiming to limit ODH's ability to do executive orders around emergency public health issues? Um, Yes, we do. I know that's important to me personally, and is important to Prevention Action Alliance. Now, there are a lot of groups speaking out against that, and because it doesn't directly relate to prevention, in the work that we do, even though it does, but it also, it kind of is all inclusive when it comes to public health. We haven't gone out to testify against it as of yet. And I know it's, they reintroduced the bill and it's still in the beginning stages. So we keep a close eye on that. So, yeah, depending on how opponent testimony goes and how the bill continues to move, then, PA can step in. That is a phenomenal question. And let me see here. Yeah, it's issues like this really are tough. Um, I wish that this was even a conversation that we would need to have. Limiting ODH's ability to give out public health orders is just something that just does not make any sense. But the General Assembly is the General Assembly. And Prevention Action Alliance, we do have limited capacity in how much we can do for advocacy. So sometimes we do have to prioritize the more prevention related stuff over the general public health stuff. But I mean, you are correct, uh, Lois. This is something that we need to pay attention to, and I will keep a close eye on that. Any other questions? Oh, and I will add one thing. So for those of you who pay attention to, General Assembly, goings, uh, I do know that they were considering an option for virtual testimony given the pandemic. The House, when they approved their rules, and I believe the Senate too, did shoot that proposal down, unfortunately. However, I believe, if I remember correctly, that the speaker did leave that option open. I think the chairs could probably make that accommodation if need be. So we'll see. But as of right now, all testimony will be in person. So that's just one thing to note, because I know there were a couple rumblings about possible virtual testimony. I believe Virginia does virtual testimony, and a few other states do as well, but does not look like that was in uh, that wasn't a priority for the General Assembly. Okay. All right. So if there are no other questions, and I don't believe I see any other hands raised, and if I did miss you, please again, raise your hand once again. If there's no other questions, we'll go ahead and wrap up today's webinar. Again, there are a few links in the chat for you all to take a look at. If you have any other questions, please let me know. Thank you for joining me today, and I will see you guys next month. Thanks.